Hi guys, and welcome to another video. If you're new here, a new parent, or you're expecting a baby, welcome, you're in the right place. So we're going to dive straight into this video on safe swaddling. So swaddling has been used in different forms all over the world. Babies in the UK are swaddled in the first few weeks of life. Some parents say it helps their baby sleep better, it reduces crying and stress, but there are some risks that I want you to be aware of as well. So let's talk about tips for safe swaddling. So first off, what is swaddling? So swaddling is the traditional practice of gently wrapping your baby up in a light, breathable blanket to help them feel calm and sleepy. It's important to only wrap their body and not the neck or the head to reduce the chance of suffocation. The idea behind swaddling is to make your little one feel snug and secure, just like they were in the womb. So there are benefits, of course, to swaddling. So what are those benefits? So some people say that swaddling seems to help their little one to settle more easily and sleep for longer. Others find that it can help calm their baby down as well. And research has shown swaddling used alongside sound, so things like white noise and rocking motion, so movement, can be effective at soothing crying babies. Another study found that babies who were born early, so who were born premature, and were swaddled were calmer and had improved neuromuscular development and better muscle tone as well, and it soothed their pain and discomfort. On the other hand, what are the risks of swaddling? So one risk is that tightly swaddling a baby's hips could increase the chances of developing hip dysplasia, which is a problem with the hip joints. So it's important to let your baby have enough, let their legs have enough room to bend up and out at the hips, so like a frog. So the hip joints can develop naturally, and you want to avoid restricting your baby's legs in a straight position. They must be able to move and pull them up like a frog in the swaddle. So is swaddling your baby safe? Yes, swaddling generally presents a very low risk for babies as long as you follow safe sleeping and hip-friendly swaddling guidance. The current advice for baby sleeping is to always lay your little one down on their back and avoid front or side positions for sleep, especially if your baby is swaddled. And remember, you should stop swaddling your baby when they start to show the first stages of being able to roll over. So what safety points should you keep in mind? So here are some tips, safe and hip-friendly swaddling tips. So number one, consider your baby's temperature and their environment to prevent them from overheating. Okay, so you might have heard of something called SIDS, sudden infant death syndrome, and one of the risk factors is overheating. So regularly check your baby's temperature, make sure they're dressed appropriately for the weather, and if they're unwell or have a fever, don't swaddle them. You can use thin material like a small cotton sheet or a muslin square for swaddling. Avoid adding any extra material on top of a swaddled baby like a blanket, because again that could cause overheating. And please follow safe sleep guidance and lay your baby on a firm, flat, waterproof mattress with no other items around them. I really like this swaddle. It's thin, it's breathable, and it's super soft cotton, and it's stretchy as well for baby to move in. And there's this Velcro bit here that's really easy for adjustment, and I'll link the product to this below. Also, don't swaddle your baby above their shoulders. The neck and the head should never be swaddled. So make sure that the material is secure and it won't come loose as your baby moves to avoid suffocation. So like I said, with these, it's got the Velcro, it should stay nice in place. You want to use hip-healthy swaddling techniques as well to reduce the risk of hip dysplasia. So allowing your baby to move their hips and move their legs freely to kick, and letting their legs fall into a natural position like frog legs rather than just straight down. So you want to make sure that the swaddle allows that. Always put your baby to sleep on their back. Okay, never ever ever put a swaddled baby to sleep on their front or their side. Okay, that's a big risk of sudden infant death syndrome. If you're using a swaddle product or a blanket, make sure it meets safety guidelines and it's without any damage as well. So follow the manufacturer's guidance on age or weight ratings, and consider using a lower TOG rating to minimise overheating risks as well. If someone else will be taking care of your baby, make sure that they're aware of safe sleeping advice and they know how to swaddle your child safely. And take the time to show them, explain safe swaddling, emphasise always putting your baby to sleep on their back. Now, how long can you safely swaddle your baby for? So swaddling should only be done when your baby is a newborn. As soon as they start showing signs of learning to roll over, or if they can already roll over, it's time to transition them away from swaddling and just using a blanket instead. If you have any questions, let me know in the comments, guys. I always read the comments, and I'll also post the link to the swaddle that I used as well below. Please subscribe to get notified for new videos. It will also help this video reach other parents who can benefit from this information and learning about safe swaddling. So thank you for watching, and I'll see you soon.